Hello, my name is Logan Baxter, and today we will be talking about household food insecurity in Nova Scotia. What is food insecurity? It is the inadequate access to food due to financial constraints. So there are three different types of food insecurity. The first one being marginal food insecurity, which are people who are concerned with food running out. It's on their minds, it's something that they think about. Moderate food insecurity are people who have issues with their quality of food or their quantity of food. It's not as accessible for these people. And the third being severe food insecurity. So these are people who have experienced reducing their food intake and having to plan when they can eat due to financial constraints. Food insecurity in Canada. In 2017 and 2018, a research study was conducted that explored 1 in 8 Canadians suffer from food insecurity. So that is from marginal food insecurity to moderate to severe food insecurity. So 8.8% of Canadian households altogether experience some form of food insecurity. This sums up to be 1.2 million Canadians who suffer from food insecurity. There are about 4% living in marginal food insecurity. There are about 5.7 Canadians living in moderate food security, and about 3% of Canadians are living in severe food insecurity. Food insecurity in Nova Scotia. Judging the same research study that was conducted in 2017 and 2018, the research study showed that 1 in 6 Nova Scotians experience some form of food insecurity. That means 12.7% of Nova Scotians experience food insecurity. That works out to be 44,700 Nova Scotians. There are about 4.4% of Nova Scotians who are living in marginal food insecurity. There are about 6.4% of Nova Scotians are living in moderate food insecurity. And there are 4.6 Nova Scotians who are living in severe food insecurity. These are the highest percentages across Canada for citizens living with food insecurity. The problem. People who suffer from food insecurity are 3.5 times more likely to develop chronic physical or mental health conditions. These people experience an overall poor quality of life. People who suffer from food insecurity actually add an additional $1,000 per person annually to Canada's healthcare system. People who suffer from food insecurity add an additional cost of poverty on the healthcare system, which equals to about $7.6 billion annually in just poverty costs for Canada. Creates chronic disease. Food insecurity is influenced by people's income, their employment, their race, and disabilities if they have physical or mental. On the right is a cycle of what food insecurity does to people. It's a cycle of stress, and how people deal with this stress is by changing their dietary quality, their eating behaviors, or by reducing their food intake. This creates chronic disease and lowers this person's employability, and also lowers the household income that these people are gaining. COVID-19 threatens Canada's food security. A Toronto survey suggests that 55% of Canadians are concerned about food security post-pandemic. There was a 200% increase of people using food banks since the pandemic. 76% of new clients accessed food banks due to job loss, and 34% of these new clients can't pay rent 4 to 6 months since the survey was conducted. The survey saw a 20% increase in the frequency of people going a full day without eating, and that's bi-monthly. The survey recognizes that 1 in 3 children go hungry. That number is up from 1 in 4 children who go hungry. And the survey recognized that 28% of respondents received the Canada Emergency Response Benefit, but that these people still rely on food banks to get by in life. Food insecurity solutions. The most popular solution for food insecurity are food banks. However, this is a short-term solution if we are ever to see a change in people relying on food banks. Another solution is a systematic policy response. Our government, provincial and federal, need to recognize and make changes in policies to help people climb out of poverty. There needs to be a government strategy to improve people's living wages, welfare, taxation reforms, and new approaches to agriculture policies. A possible solution is for co-location of healthcare and social services. This would ease people's accessibility so that they do not have to go to 2 different locations for their healthcare and social services. Another solution would be to extend universal basic income, so something similar to what Canadian seniors receive through old age security. A proven solution, the poverty reduction strategy. The province of Newfoundland and Labrador introduced a poverty reduction strategy between 2003 and 2011. The provincial government had 13 governmental agencies working together to change the province's systematic policies. In 2003, the province recognized that the median family income for residents was $47,900, that the jobless families rate was 14.9%, and that 10% of people were receiving income support in the province of Newfoundland and Labrador. After implementing the poverty and reduction strategy for several years, the province was able to increase its median family income to $60,300. They were able to reduce the jobless family rate to 12.5%, and the province was able to reduce people who rely on income support to 7% from 10%. How do they do it? The government of Newfoundland and Labrador set 5 goals to reduce their food insecurity and poverty rate. The first goal was to improve access to and coordination of service for low-income people. The second goal was to build a strong social safety net. The third was to improve earned incomes, so this would be people's median wage and how much they make yearly. The fourth goal was to increase the emphasis on early childhood development. And the fifth goal was to better educate the population of Newfoundland and Labrador. Food security is within reach for Nova Scotians. If the province of Nova Scotia were to expand a poverty reduction strategy, the province would improve citizens' quality of life, it would improve early childhood development, the system would educate its citizens, and the system would support families who are in need most. All of this combined would help end generational poverty.